Good evening. Hi, Mayor Whitmire, every esteemed council member. Thank you so much for hearing me today. I'm Arlene Rose, also known as Nurse Rose, publicly and trademarked. The reason why I'm here today is the rising rates of suicide is the trajectory. If it continues to rise, it's insurmountable. In 2022, there has been over 4,000 suicides in the state of Texas, with Houston accounting for the second largest number of that population. The concern here that I have is I see that Harris Center is doing a great job of supporting the underinsured as well as the served community, those that do not have access to care. But there's a gap. That gap is the population of individuals that account for individuals who are working, which is 45% to 55% of the community. That gap means that the population who are paying or working for insurance or for their insurance aren't served, because even though Harris Center is able to provide support to those individuals that are underserved, the rates of individuals that are working, such as individuals like yourself, City Hall employees, and the 22,000 of the Houston City members are not addressed. That gap accounts for the rising rates of suicide. And I say that significantly because the number one member of suicide members is veterans, then automotive workers, IT, those who work in IT and data, those who work in construction, teachers, our physicians, our nurses, public order, justice members, volunteers, students, oil workers, and those in trucking. These are working individuals who do not have a support or liaison within the city of Houston for specific mental health prevention or mental health addressed needs and suicide prevention. That's the problem. Why am I here to speak about it? Again, I'm Nurse Rose, and I'm an advanced practice psychiatric nurse practitioner, and I serve the community by providing mental health services under my practice. Additionally, I am a public health nurse certified, as well as a board-certified gerontology nurse. I am certified now newly as a MBP, PDEP, as well as a minority business and women-owned enterprise. And I think that I can offer some support to City Hall specifically, and also to the community. In November, I am organizing and supporting the first inaugural Houston Health and Wealth Expo, which is a conglomerate of individuals coming together to provide support to entrepreneurs and individuals that do represent that 45 to 50% of members who are not included in the underinsured and underserved community. Additionally, I am also a provider.
Your time has expired.
Go ahead and finish your comments.
I'm a provider under the CompPsych EAP program, which is the EAP program that is utilized specifically by City Hall. And even though I am a member of that CompPsych, the rates of individuals contacting me there is very low, meaning that it's not well spoken about. I do believe that having a liaison within the City Hall or the City of Houston, directly addressing to that population, would provide a substantial benefit to the community and the rates of suicide that are rising. If you think about it, the rates are rising, even though the support for suicide initiatives are increasing. So that means the gap is not addressed. If we continue on the trajectory from 2000 to now, 35% of suicide, the rates of suicide have risen 35%. So despite the initiatives that started in 2001, there is a gap. And if we continue to ignore it, the gap rises. And I believe that we cannot.
Very good. Thank you for being here. We've had a long day. Next.
Councilman Pollard.
Oh, Councilman Pollard, I'm sorry.
Thank you, Mayor. Nurse Rose, I want to thank you for coming forward and for your information. I'm very much interested in exploring this more with you, so I will reach out and have my office set up a time to discuss further. Thank you.
Thank you. Thank you, Mayor Whitmire.
Ma'am. There's another question.
Sorry, I was late to push the button, but I also appreciate your coming. I'm interested in that EAP, what you said. So I always thought that was a well-used program. It's not?
Not as well used, and I know that because, again, I'm one of the providers.
You're one of the providers. Okay. Another thing, Mayor, that I've heard from people is that on our insurance, there's limited, I guess depending on what plan, limited access to mental health professionals. There's like a few that are in the plan, or the ones that are in the plan are so incredibly busy that most people seek out somebody outside the plan, which is a lot more expensive. So definitely something I want to explore when we're looking at our health benefits contract next time. But appreciate your well thought out proposal. I've always kind of wondered. I mean, we tend to like talk to people, like send people like the health department, but that's really to send them, then they go to the county. So interesting perspective here, and thanks for coming.
Thank you.
Councilman Ramirez.
Thank you, Mayor, and thank you, Ms. Rose, for coming forward. I can tell you put a lot of work and thought into your proposal, and thank you for thinking of our city employees. Appreciate you.
Thank you. I did. It took me a few months to get certified, then the proposal, and I just really want to make sure that we understand that these are us, individuals who are working, who are not being addressed, and that gap is rising. Thank you.
Next.
Charlene Ford.